Moving into the flattening of the curve, as they say. Next slide, please. The ASEAN health sector, after immediately responding to the evolving outbreak in early January 2020, sustained and further expanded its interventions through existing mechanisms and platforms in cooperation with ASEAN sectors and other external partners. Through the various ASEAN health sector cooperation platforms, we have continued to, as shown in the slides, share situational updates and response information, technical exchanges, even real-time critical information and operational referrals via mobile instant messaging through ASEAN Emergency Operations Center Network for Public Health Emergencies. The ASEAN health sector has also shared preparedness and response strategies, good practices, as well as operational challenges, gaps, and needs within ASEAN, also together with other countries, which we call +3, particularly China, Japan, Korea, also with Italy and United States through various webinars hosted by the health sector, as well as the network platforms in ASEAN. There were also regular reporting that is provided 3 times a week. Can you hear me clearly? Hello?
Yes, Mr. Ferdinal, we can hear you clearly.
Thank you so much. I think there's some incoming noise. Sorry for that. So there were also regular reporting on the risk assessment for international dissemination of COVID-19 in the ASEAN region through the ASEAN Biodiaspora Virtual Network, as shown in the slide. In the bottom half of this slide, the ASEAN health sector has also carried out exchanges on disease surveillance and laboratory readiness and response actions, and technical and material support through existing health networks in the ASEAN region, as shown in the slide, bottom half of the slide. And we have also cooperated with other sectors and ongoing COVID-19 response, as well as strengthened preparedness through future initiatives. And the ASEAN health sector is also having ongoing national risk communication efforts, including addressing false information and fake news through the risk assessment reports produced by our centers dealing with big data analytics and visualization. For slide number 5, the next one, as the ASEAN health sector continues to its response according to the evolution and trajectory of the outbreaks in ASEAN member states, the ASEAN health sector, through its health ministers, convened a special conference on April 7 among the ASEAN health ministers, and also together with the ASEAN +3 health ministers. I'm referring to China, Japan, and Korea. And also on the 31st of April with the United States. In these meetings, they have reviewed the current situation and responses, and agreed on certain outline priority policies and strategic directions for the ASEAN health sector. This include the list that is projected in the slide in front of you. Among this would be the exchanges of timely data and information sharing on COVID-19 prevention, detection, and response measures through existing ASEAN health sector cooperation mechanisms, regional cooperation and risk communication on COVID-19, utilizing digital technology and artificial intelligence to facilitate timely implementation of public health responses, cross-border contact tracing and outbreak investigations, capacity building and resource mobilization in interventions on public health emergency preparedness and response, support to timely technical material and financial resources critical to sustaining national health system response, including drug and vaccine security and self-reliance. And also research and development on appropriate innovative tools and interventions in stemming the outbreak, among others. No? Next slide, please. Slide number 6. So this slide shows that the ASEAN health sector is cooperating with various external partners, which we call as dialogue and development partners, through the following initiatives as shown in the slides. One would be in terms of enhancing the detection capacity for COVID-19 in ASEAN member states with the support of Republic of Korea. The development of an ASEAN portal for public health emergencies with the support of Canada, and later on by our development partner GIZ. The conduct of feasibility study on the establishment of the ASEAN Center for Public Health Emergencies and Emerging Diseases with the support from Japan. There are also several research and innovation initiatives on COVID-19 with the European Union through the coordination and cooperation of specific research institutions from ASEAN member states with their counterparts in the European Union. We have also upcoming plans in formulating ASEAN Public Health Emergency Coordination System and cross-border contact tracing and outbreak investigation through the possible support of the United States and also through the leadership of Indonesia. We have also ongoing initiatives that is supported by Canada with regard to various regional projects and national projects on the mitigation of biological threats. This particular MBT program, or Mitigation Biological Threats Program, facilitated ASEAN health sector in institutionalizing the ASEAN Emergency Operations Center network for public health emergencies, as well as programs on big data analytics and visualizations utilized in risk assessments. And there are also recent activities that were cooperated at bilateral and regional levels with China, Korea, and Canada in terms of providing technical assistance, exchanges, and provision of medical supplies and equipment to ASEAN member states. Moving on to slide number 7, we would just like to highlight that ASEAN, aside from the health sector, there are also non-health sectors that responded to COVID-19 at bilateral and regional levels, belonging to the pillars of the political, security, economic, and socio-cultural communities. These were complemented definitely by the ASEAN health sector cooperation in the response to COVID-19. At the political level, special ASEAN summits on COVID-19 were conducted involving the ASEAN leaders and leaders from the other dialogue partners. There were also various special high-level meetings involving the sectors of foreign affairs, economic, tourism, social welfare, and labor that were conducted to specify the respective role in COVID-19 response. Other platforms of coordination involving relevant stakeholders on COVID-19 were likewise established and undertaken, such as the ASEAN Coordinating Council Working Group on Public Health Emergencies, or ACCWGPHE. The recommendations of this working group were elevated or are currently being elevated to the ASEAN Coordinating Council for further direction on the ways forward. Next slide number 8. So these are key ASEAN priorities for COVID-19 pandemic response and future preparedness coming from other non-health sectors. So in order to address the pressing challenges brought about by COVID-19, other cross-sectoral initiatives at the ASEAN-wide level or regional level discussed certain initiatives at the ACCWGPHE, or again, the ASEAN Coordinating Council Working Group on Public Health Emergencies, and elevated it to the ACC. And some of these initiatives on COVID-19 were led by Thailand and Vietnam. Among this includes the establishing a COVID-19 ASEAN Response Fund, wherein the terms of reference have been recently endorsed and will be implemented through the leadership of the health sector. Others are the concept papers that are being finalized as of this time on the aspects of ASEAN Regional Reserve of Medical Supplies, as well as the standard operating procedures for public health emergencies. Other ongoing or upcoming plans include the following: developing a pandemic recovery framework plan, which would basically involve the sectors under the ASEAN economic pillar. There are also initiatives in further supporting the ASEAN EOC network for public health emergencies, as well as the ASEAN Biodiaspora Virtual Center to sustain their operations. Other initiatives include the supply chain connectivity and normal flow of trade, services, and investments. So relevant sectors are ensuring and sustaining that the supply chain connectivity will continue. There are also upcoming initiatives or ongoing initiatives in building a regional pool of experts on COVID-19 response, which would not only involve the public health experts, but also other experts belonging to other sectors. And also, there are current initiatives in establishing further a broader regional platform for cross-sectoral consultations and cooperation on potential pandemic hazards, including pandemic and public health emergency-related issues in the next ASEAN blueprint. So aside from responding to COVID-19 response or initiatives from the ASEAN health sector, the non-health sectors in ASEAN have likewise stepped up and have built their own initiatives to support the whole of society, whole of government approach in mitigating the COVID-19 pandemic. So third to my last slide, slide number 9, the next slide, just shows you the other sectors within the ASEAN Socio-Cultural Community Pillar, which have responded respectively in terms of their role in COVID-19 response. You have the labor, sports sector, as well as the social welfare and development sector through their gender initiatives, as well as the role of the ASEAN Secretariat itself in terms of sponsoring, facilitating, or coordinating various webinars on COVID-19 involving various stakeholders and experts. And second to my last slide, slide number 10, I would just like to share the following links as well as the following information for your kind reference. As I mentioned earlier, we have this risk assessment for the international dissemination of COVID-19 to the ASEAN region. So this is being led by Philippines through the ASEAN Biodiaspora Virtual Center in cooperation with Canada and technical agency Blue Dot, wherein big data analytics and visualizations are utilized in producing a thrice weekly report. And the slides that I have shown with you earlier, particularly slide on the epidemic curve, are also reflected in this report. And in parallel, we have this two issues of ASEAN magazine, wherein it highlights the various sectors of the ASEAN sociocultural community pillars. And for the first two issues, including this second issue that is being projected in the slide, would also include updates on COVID-19. It's a part of the current section on shifting currents. So if you want to check details of my presentation as well as other references with regard to what I have mentioned, kindly look into these two documents and also access them through the links that I have provided in the slides. So colleagues, as part of my last slide, which is a thank you slide, the ASEAN health sector, through the leadership of the current chair, Indonesia, reaffirms its commitment to do its best to carry out its best initiatives to protect the people of ASEAN from the dangers of COVID-19 and other possible public health threats in the future. Thank you very much for your kind attention and for giving me this opportunity to share the ASEAN health sector and non-health sector collective efforts to address COVID-19. Thank you very much.
Thank you very much, Dr. Fernando. That was very, very informative. You have sort of shown us a great number of initiatives that ASEAN has already carried out. And I should also mention that, ASEAN has already had two leader summits, using the virtual, facility. And there was a Hanoi plan of action on strengthening ASEAN economic cooperation and supply chain connectivity in response to the COVID pandemic, which was adopted on the 14th April of 2020. So I think ASEAN seems to be moving in the right direction.